Hi everyone, thank you so much for coming to this talk. We're going to talk about distributed modular identity or decentralized identities in the pharma ecosystem. But before that, let me tell you about me. This is me. My name is Ali Ibn Satoshi. I'm the inventor of USDC Classic on Ethereum's Lightning Network. Everybody knows that. I was selected as Forbes 10 under 10. I achieved a lot before 10. And I'm a patient of rage quit, which is a very serious disease. Now, we all know that this is hogwash, which is a nicer term than bullshit. But the idea is this brings me to my topic. How do you know that this is all hogwash? You guys see me here. You saw I'm much good looking than this guy. And you can verify my identity. So I'm making some claims, and you guys are the verifiers. Now, imagine there is a pandemic, which is really hard to imagine these days, right? You have, for example, certificate issuers, which could be different labs, hundreds of labs in different countries, issuing these certificates. And then you have people who need to verify this, which could be police, it could be event managers and whatnot from different countries as well, with different systems. So you can see it can not be the easiest task. What if we have one guy in his mom's basement issuing COVID certificates as well? And they are all valid certificates on blockchain as well. How can these poor guys now verify that this certificate comes from an authentic lab or an authentic hospital and whatnot? So, how do we verify identity nowadays? You'll be surprised how many places they verify the identity by actually making a phone call. So you go somewhere, show your certificate, and these guys like, okay, I cannot scan this QR code, or this certificate is in Thai or in Arabic, and people cannot even read it. All they have to do, they see a number, they start calling, and that's sadly how we verify identity in the healthcare ecosystem. The other option, which is a bit more digital, where you can take a picture of your ID next to your face and stand like this, and then take the ID with your face, and then say hello to the camera. And now the question is really, is this the most digital way we can verify identities? If we verify identities by scanning an ID from a government, we might as well just send scan of notes instead of sending emails. Why are we sending emails? Why don't we just write down and send a picture of that, right? Or instead of sending crypto, why don't we take pictures of checks and send it to people? Of course, that's not the best way to handle this. And that's why it comes to this point, like we are in 2022, and we are still not able to verify identities digitally. And these are the questions that we're trying to answer at Roche, and I would say in almost any pharmaceutical company. How can patients interact with our services in a secure manner while keeping their data secure and safe? And how can organizations like Roche and others verify that these patients are the ones who say they are? And how can we mirror this real-life verification, however, in a digital way, in a secure way, where I can know every single patient, they are the patient that consumed our products, and we want to know information about our products. How is our product performing? So what are we doing at Roche? Maybe a distributed identity? So the goal is to have one identity that represents you in the whole healthcare ecosystem. However, this is not just a simple identity that you can have in a database. We're trying to build what we call DMI, a distributed modular identity. This solution will help patients to own their data, share the data with the people that they want to share with, for the purpose that they decide to share with, and for the amount of time that we agree on, and potentially even get rewarded for doing so. So before I go a bit deeper in the topic, one thing we have to understand is an interaction. What is an interaction? So it starts like this. This is a very high overview about how we're trying to build a distributed modular identity topic. We issue credentials for doctors that we trust, for hospitals that we work with, and for labs that we are collaborating with. And then you have the patients coming to these doctors and doing what we call a handshake. And this handshake is the interaction, the first interaction between a physical doctor with a physical patient being there. And now once they do the handshake, they will co-sign the transaction, and then we broadcast that to a public blockchain. In this case, it's called D-Health Network, which is a public blockchain, a fork of Symbol, if you know Symbol. However, the data itself, all the medical records, they're not on the chain, they're on IPFS encrypted. So but how does it work? So you have the patients. They first have to create a DME identity, which is simple. It's just a wallet. Just imagine that you have your wallet address, and that's your identity. Then you grant access to the healthcare providers. For example, when you go to a doctor and he scans your QR code, now this doctor is able to upload files on your identity. Then they give you the diagnosis and they certify you. For example, now I know that this patient is a certified hemophilia patient, so I don't need to know anything else about them, right? We upload this data to IPFS, and then Roche now is able to query the interactions of a specific segment. For example, I want to know how is my Hemlibra medication affecting hemophilia patients. Then I can scan only the tags of hemophilia, and what do I get in return? I get just a wallet addresses, which does not really reveal who the patient is. After that, I can request a consent from these patients to share only the outcome data with us, which means I don't care about your name, sex, gender, whatever games you age quit. All I care about is, in the case of hemophilia, how many bleeding events are you having? Once they grant us access to that, we aggregate the data, and now we are able to measure real-world evidence, or we gather real-world data from these outcome data. Here, to simplify how this process happens, a patient would go to a doctor, have a visit, the doctor would show a QR code, the patient would scan it, and now this is the handshake happened, and now the doctor is able to upload files on the folder of the patient. Now, to understand how this works, it's very simple. Just like you have a Windows machine, you have the root folder. In your root folder, you have your personal identity, which is like all your real name, age, all kinds of things. Under this root folder, you have other folders. And this is like the layer 1 folders. For example, you have dental folder, hemophilia folder, cancer folder. And every time you go to visit a doctor, you are able to give them access to the granular folder that you decide. For example, for my dentist, I will give him access to the dental folder. So they can upload their files there. And whenever I go visit another dentist, I have this data portability aspect. I can go and give them access to the exact same folder without having a conversation between all the dentists. And then at Roche or any other pharmaceutical company, we can request access, as we said, and they grant us to a zero-knowledge data, basically, where we cannot identify them, but we can still get the information that we need for us to measure the outcome of our products. And this comes, for example, from our researchers who would query the data and try to get aggregated information. So the question is now, why are we doing this? Why DME? First of all, it's a compliant data sharing without a third party. What you have to understand, how do we do this now? Currently, we hire, or we go to a service provider that would hold all the patient's data. And we would pay these guys to hold this data because personal data is a liability, right? And so these guys will give us eventually the data that we need from them without giving us the personal data. We are now able to remove this third party and still be compliant with GDPR and all kinds of data privacy rules. The second one, this is very obvious when you use blockchain. You have data integrity because you're always hashing the interactions. You're hashing the data and putting this on the blockchain, so you're able to verify that nothing has changed. The data privacy aspect comes from the patients owning their data, and all the data is encrypted. Actually, the consent is not just a consent on paper. It's actually the key to decrypt the data. We call this support beyond the pill because once we have this data, we have access to the patient's outcome data. We're able to communicate with the patients directly and allow them to get more information about their disease, translating real-world data to evidence, and this is the most important thing, the health data ownership. Why are we using blockchain? Simply removing third parties, which helps us to reduce cost, right? Improve security, and the most important one is the ownership of the data. Quickly, some challenges we're having, and then we move to questions. is the legal problems. You have to understand about the data, where is it held? For example, IPFS node, which IPFS is, for example, pinning the data, the location of it, security risk, and some ethical ones. And that's it. Let's connect if you guys are interested in this topic. Here's LinkedIn and Twitter. And it's open now for questions if anybody has any question. Otherwise, you can find me around and just shoot questions there. Thanks. You need a decentralized mic. Microphone is not working. You can do it offline. Very nice. So the question is this for Roche patients only, and are we creating a wallet? So the first part of the question, no, it's not only for Roche. We are building this with a collaboration with the Health Foundation. However, we hope that more pharmaceutical companies will jump on board, because as a patient, they don't want to have a Roche solution and another Novartis solution, whatnot. They would like to have one place where they hold their data and they can move between them. We don't have our own wallet. We're utilizing the tools that are provided by the public blockchain, which is called eHealth. Thank you. And if anybody, do we have time for more questions? All right, so there is a question. Usability. Yeah. Very good question. So we're trying to hide the blockchain from the user. As a user, you don't really care about what technology is going in the background. So technically, you would have a username and a password. However, your keys are stored on the phone. To restore this, we're trying to come up with a backup concept where you give parts of your key shards to the trusted families, members, or friends, and you're always able to retrieve this key when 3 out of 5 of them would be there to sign this transaction, and then you can gain access back to your. But however, this is really the backup topic when it comes to decentralized applications, one of the most challenging ones. So, good question. Sir, yeah, go ahead. Yeah, I think so.
It's okay. It works.
So when it comes to GDPR and the right to be forgotten, one part you answered yourself. If the data is encrypted, then it's like if you remove the private key, you're no longer able to decrypt that. Now, in 30 years, if we are able to break encryption, I don't have an answer to that, to be honest, when quantum computing comes to the mix. But I hope by then the data is expired and useless. So the data is like, we always have to keep the data for 10 years or 15 years. After that, most of our medical records are no longer valid. So the patients, either they recovered from the patient journey or they passed away. So I don't have an accurate answer, to be honest. We will have to think about this one. It's a very good question. All right, guys, thank you so much, and see you around.
Thank you.